Thank you. Tomorrow, we are going to be holding a vote to put every single Republican senator on the record as to whether they genuinely support IVF and want to make sure we avoid more heartbreak and chaos like we saw earlier this year. We cannot pretend this threat isn't real, not after what happened in Alabama. But I know folks in Washington State are deeply concerned that unless we take action, that may well just be the start. Because the fact of the matter is, Republicans have a bill right now that would enshrine into national law the idea that a frozen embryo is the same, has the exact same rights as a living, breathing human person. In other words, a bill that would take the chaos like we saw in Alabama nationwide and jeopardize IVF access everywhere, including in Washington State. This is not some fringe bill. Either the Life at Conception Act has the support of half of the House Republicans, including the Speaker of the House, and including some Republicans who claim to support IVF. That just does not add up. IVF and fetal personhood laws are fundamentally incompatible. That's why we are holding a vote tomorrow that will put every single senator on the record as to whether they actually want to protect IVF and whether they actually want to help people get it. Our bill is the Right to IVF Act. It protects the right to IVF nationally. It lowers the cost of IVF for families with stronger insurance coverage requirements. And it includes my law to make sure more veterans and service members can access the IVF services that they need. As we discuss these issues, I am really glad to be joined by Dr. Ryan, who has a first-hand perspective on why getting patients access to IVF is important and what sort of threat fetal personhood poses. IVF is already painfully expensive and inaccessible for too many families. That's why it's so important we pass legislation that protects IVF care from new restrictions and bans and will help make sure that this care is more affordable for families. When you talk to anyone who's gone through IVF or is hoping to go through it, it's clear how important this is to people. It is personal. It's emotional. It's their entire hopes for growing their family. We need to be taking down barriers like cost and not letting anyone put up new, completely unnecessary restrictions. So we're not going to let anyone off the hook at just saying they support IVF, not when there's so much at stake for our families. Instead, every senator is going to go on the record and put down their vote on the Right to IVF Act and show whether they will work to pass a serious bill to protect and expand IVF access for patients. And families, providers, and people across the country will be watching closely. It is my pleasure to turn it over to Dr. Ginny Ryan, who knows better than anyone exactly why IVF is a medical procedure that has to be protected.
Thank you. Thank you so much. It's a real honor and a privilege to be here today with you, Senator Murray. I'm here as a reproductive endocrinology and infertility physician for the past 21 years. The last 4 of those have been in Seattle, and the last 8 of those I've been part-time at the VA healthcare system. I'm also a bioethicist and a researcher, and I'm a fellowship program director for the next generation of our subspecialists. Over 3% of all babies born in the United States each year are conceived through IVF, which means more than 8 million people have benefited, have been born thanks to this amazing technology that was developed by the scientists that eventually won the Nobel Prize for it. And 365 days a year, highly trained physicians, researchers, scientists, embryologists, and nurses work to help the 1 in 6 people who are suffering from infertility. They use evidence-based, scientifically proven techniques and treatments to help build their families and to help preserve their fertility. And that 1 in 6 doesn't even cover the members of our LGBTQ community who need these types of treatments to build their family, for those people facing cancer and other medical illnesses that need our help to preserve their fertility before their treatment, and those people carrying genetically heritable diseases that we can help them prevent to pass along to their children. Restricting or banning IVF is heartless for these patients. It's disorienting, it's disheartening for the professionals who are working on this every day, and it's frankly dangerous. And it further restricts access to a treatment that's already very difficult to access. It's underinsured, and for rural people, it's very hard to access already. It also prevents a barrier to us training the next generation of providers. So I'd just like to thank Senator Murray and her partners, Senator Duckworth and Booker, for all of the work that they've done and continue to do with this Right to IVF Act on behalf of our patients and all of our professionals. Thank you.
And we're happy to answer any questions
from folks in the newsrooms. You can go ahead and unmute yourself. Just let the senator and doctor know your outlet before asking your question. All right, one last call for questions. I did see someone step away from the Fox 13 News desk. So just want to make sure before we conclude today's call, if you have any questions, now is the opportunity. All right, hearing no questions, we'll turn it back over to Senator Murray to close us out.
Well, let me just thank all of the people who called and told their personal stories and said why this is so important. We're at a really important time. I never thought I would be in a position where we would be having to discuss making sure that this is protected. But when Roe was overturned, it opened up chaos across the country. We've seen it in so many ways, and IVF is a target in this discussion at this time. That's why we're working so hard to make a national law to protect it.
Concludes today's press call. This will be recorded and distributed widely. Thank you so much for joining.